Welcome to your exam preparation guide focused on therapeutic duplications, a critical component of the PTCB certification examination. Our primary focus is patient safety. This study guide is structured into 6 modules, covering the foundation of therapeutic duplications, high-risk drug classes, detection methods, practice questions, case studies, and overall exam strategy. Therapeutic duplication occurs when a patient receives multiple medications from the same therapeutic class or with identical mechanisms of action. This error accounts for 6% of prescribing errors. The clinical impact is severe, increasing adverse reactions like bleeding from anticoagulants and serotonin syndrome from SSRIs. Remember, the exam tests patient safety first, so always notify the pharmacist. We focus on high-risk drug classes. ACE inhibitors and anticoagulants pose very high risks, like hyperkalemia and major bleeding. SSRIs carry the risk of serotonin syndrome, and NSAIDs risk GI bleeding. Remember 3 key strategies. When you see any drug pair from the same class, always question if it's safe. Elderly patients are at the highest risk. Always ask about over-the-counter or OTC medications. ACE inhibitors and ARBs represent a deadly overlap. Duplication can cause hyperkalemia and acute kidney injury. The PTCB exam often tests your knowledge that combining an ACE inhibitor and an ARB is usually dangerous. Anticoagulant duplication is a bleeding emergency involving combinations like warfarin and apixaban. Your role is immediate intervention. Alert the pharmacist, hold the prescription, and document your actions. Duplication of SSRIs, such as sertraline and citalopram, carries the risk of serotonin syndrome, a medical emergency. Combining these agents rarely offers increased efficacy, but enhances side effects. NSAID duplications, such as ibuprofen and naproxen, commonly involve OTC products and prescription medications. The risk includes GI bleeding and kidney damage. Always ask patients about OTC use. Detection systems use the Anatomical Therapeutic Chemical, or ATC classification system, to flag potential duplications. Be aware of alert fatigue, which can cause providers to miss critical warnings. Your role is to notify the pharmacist before dispensing. In this classic ACE inhibitor trap, a patient has prescriptions for lisinopril and enalapril from different doctors. The correct action is always C. Immediately notify the pharmacist about potential therapeutic duplication. For this hidden NSAID danger scenario, the patient takes prescription naproxen and OTC Advil. The best action is C. Alert the pharmacist about potential therapeutic duplication, as computer systems may not flag the OTC error. In the anticoagulant emergency, the patient has active warfarin and a new prescription for apixaban. This is life-threatening. The correct response is C. Immediately consult the pharmacist before dispensing. PTCB questions often involve multiple prescribers or OTC overlaps. Look for red flag phrases like different doctors or also taking. The wrong answers usually involve ignoring the risk or making clinical assumptions. Your role in prevention includes collecting a complete medication history, reviewing the profile for red flags, and immediately notifying the pharmacist. Documentation is crucial for legal protection. In this case study, a patient was incorrectly taking both an ACE inhibitor and an ARNI due to a communication gap between the EHR and the pharmacy. This highlights the importance of patient counseling to verify changes. Case study 2 shows the high risk posed by multiple prescribers. Pharmacy technicians must be proactive in identifying potential duplications, as communication breakdowns are common between prescribers and pharmacies. Memorize these high-frequency pairs: lisinopril and enalapril, warfarin and apixaban, sertraline and citalopram, and ibuprofen and naproxen. These are crucial for exam success. Also focus on calcium channel blockers like amlodipine and nifedipine, which risk excessive hypotension, and opioids like codeine and oxycodone, which risk respiratory depression. Therapeutic duplication is sometimes intentional, such as short-term bridging therapy or combination therapy for resistant conditions. Intentional duplication is characterized by clear documentation of intent. Medication reconciliation is a 3-step safety net. Collect a complete list, compare it with new orders, and communicate changes. Technicians assist in history collection and must flag potential duplicates. Regulatory standards require pharmacist review of all orders to detect duplications. Your scope allows you to identify and notify the pharmacist, but never make clinical judgments or dispense, despite concerns. Alert fatigue is a major issue where frequent, often insignificant alerts cause providers to ignore serious warnings. Therapeutic duplication alerts, especially for high-risk drugs, require immediate escalation to the pharmacist. Patient counseling is essential for uncovering hidden duplications, especially OTC use. Always ask specific questions about pain relievers and recent medication changes. Mastering ATC codes helps identify duplication. If two drugs share the same 4-level ATC code, they are therapeutically similar. For example, CO9AA for ACE inhibitors. Question 1. Omeprazole and pantoprazole is therapeutic duplication. Question 2. Warfarin and enoxaparin for bridging is appropriate duplication. Question 3. Naproxen and OTC ibuprofen requires alerting the pharmacist. Question 4. Therapeutic duplication is detected using ATC codes. Question 5. Anticoagulant duplication requires immediately alerting the pharmacist. Question 6. The primary risk of SSRI duplication is serotonin syndrome. On test day, look for key phrases like different doctors. For life-threatening scenarios, the answer is almost always notify pharmacist. Eliminate options that involve ignoring patient safety. Follow this 7-day mastery plan. Day 1 covers the foundation. Day 2 focuses on high-risk ACE inhibitors and anticoagulants. Day 3 covers SSRIs and NSAIDs. Day 4 focuses on detection and prevention protocols. Day 5 is dedicated to practice questions. Days 6 and 7 are for review, focusing on weak areas and final concepts, ensuring you are well rested before the exam. Remember these key takeaways. Therapeutic duplication means multiple meds from the same class. Always notify the pharmacist for high-risk duplication and never ignore OTC plus prescription overlap. Patient safety is first. You've achieved mastery in therapeutic duplications. Always prioritize patient safety. When in doubt, notify the pharmacist immediately and trust your training.